Good afternoon, everyone. We are thrilled to welcome you to JPEF 2025, the 13th edition of Jyothydev's Professional Education Forum, a platform that continues to evolve, inspire, and lead academic discourse in diabetes, obesity, and metabolic science. It's a delight to see such a vibrant gatherings of clinicians, researchers, educators, and healthcare leaders, all united by one shared purpose: advancing the future of diabetes care. This year's theme, Weight Matters, brings our attention to two critical aspects in diabetes: the impact of waiting or delaying care, and the importance of body weight in disease progression. Every session today reflects how timely action, evidence-based decisions, and compassionate care and truly make a difference. We welcome you to Periyar Hall, where a series of transformative sessions await. All the topics are curated around practical innovation, evidence-based care, and clinical excellence. Once again, welcome to JPEF 2025, where knowledge meets innovation. We now invite you to the Dreams panel, featuring heartfelt insights from people living with type 1 diabetes, or as they call themselves, T1D Pookies. The session is moderated by Dr. A.V. Raveendran, Specialist Internal Medicine, Badr Al-Sama, Sultanate of Oman; Dr. Banshi Saboo, Global Council Member, ESD, and Chair of IDF Southeast Asia; Dr. Jothydev Kesavadev, Chairman and Managing Director at Jyothydev's Diabetes Research Center and Organizing Secretary of JPEF; and Ms. Aishath Shiruhana, CEO and Chairperson of Diabetes Society of Maldives; and Dr. Tadej Battelino, Head Department of Endocrinology, University Children's Hospital, Slovenia. Welcome you all.
To these three important advocates from India, from type 1. If you can just introduce in one or two lines, it will be very good, and then we can start the discussion.
Just name them. I mean, she is there, diabetes, like that.
Good afternoon, everyone. I would like to introduce our panel. Ms. Jyotsana, Rangeen, founder, Diabetes in Style, Community Manager, Diabetes India Youth in Action, and Southeast Asia Representative, IDF Young Leaders in Diabetes. Ms. Mehak, Dhingra, she's been living with type 1 diabetes since 2007. She is a certified diabetes educator. She is also founder of Unstoppable Diabetes. Ms. Indu, Thampi, she is an actor, T1D advocate, content creator, and also Miss Kerala 2010. She is a lead actress in Malayalam films, including 18 Hours, Enable, and Father's Day.
So this panel is very interesting, and Jyoti have designed the way that, it's a dream panel. What I wish doctor knew, and this will be advice to the medical world from type 1 diabetes Pookie. So it's very interesting. We all want to listen as a doctor, and all those audience also from you people, that what you would like the doctor should know. And we have with us an international expert. Everyone know Dr. Tadej, who is a world leader in technology. He himself is a pediatric endocrinologist, and he treats a lot of type 1 with advanced technology and ATTD chair. So we welcome Dr. Tadej here, and we will listen from our type 1 advocate that what they want, and then we will take his view also and the Indian perspective also. Over to
Thank you so
Jyotsana,
much,
Mehak,
sir.
and yes, everyone. Thank you.
Thank you, sir. Thank you for inviting us, Jyothi sir. Thank you for inviting all of us. I'll start with something I want to tell you all. Diagnosed at the age of 15. Most of the people think I was diagnosed with type 1 diabetes, but I was diagnosed with more. It was depression. It was silent fight. It was not knowing what is happening. It was difficulty to face the same friends I used to play with. Type 1 diagnosis is not just a diagnosis of a condition. It's way more. And I wish at that time somebody understood that and helped me deal with that. So now, Jyotsana.
Thank you, Mehak. Thank you for the honor, for the invitation. Thank you, Dr. Jothydev and the whole team for inviting me. This is my first JPEF conference, so it's very special. And I just want to say on this topic is that what I wish doctors knew. I was diagnosed a decade back, and all I wanted is someone to listen to me, to what I was going. I was diagnosed as an adult. I was just 21 years old, and my whole life changed 360-degree diagnosis. But what I felt that I wanted from my doctor, or what I wanted to hear from my doctor, is that how are you dealing with it? How are you going? Where a person is diagnosed, newly diagnosed, there are so many things going on in their mind. You know, the struggles, the difficulty of acceptance of that condition, the stigma and misunderstandings and the misconceptions, especially a woman that goes through. I was told to hide my condition for 2 years. I was living in a prison in denial of what my condition is, until I met someone. I met amazing doctors like Dr. Banshi, Saboo, who became my inspiration and idol, who helped me learn what advocacy is, who pushed me into that world that, see, this is what you can be. And that really changed my life for good. So I would say that, what I wish doctors knew is that our mental health is so important. When we talk about type 1 diabetes, there are so many things that goes on in our mind. And during those rushed appointments, if a doctor can say that, how are you feeling today? Instead of saying your A1C could be better, if the doctor can pause, smile, and say, how are you feeling today? And what is going on in your life? And I think that small change can make a huge impact.
Hello, I'm Indu, and a bit different from what these beautiful Pookies also said. I was diagnosed at a time when even most doctors, they had no idea what was actually going on with me. It was a time when information, technology, and medicine about type 1 diabetes was not that available. So at the age of 7, when I was diagnosed, I was in a place where I was prescribed human mixture twice a day with, I used to use glass needles, and we had a Benedict solution at that time. So this was my world, with a once-in-a-blue-moon visit to a doctor who had some idea of what I was going on, but not exactly completely. So this is how I lived. About 8 years later, until that huge gap, there was this huge place where I had no clue what was happening in my body. I had no clue what was happening with my life, and I'm sure more tensed was my parents, who were completely bewildered as much as I am. But as a child, when everything pauses in your life is just upturned. And especially without information, you don't know what to predict, what happens, how to get out of it. But one thing taught me something was resilience and light, which I saw from my mother, which I'm sure that, I could have got from my care practitioner, yes, but he was not that close to me at that time. And I started living a life where I started depending on myself, listening to my body, my activities, because I did not want this new difficulty, whatever it was, to, bound me in and make me a slave of it. I started to find ways to, balance and adjust. Now, there's a bad point of it. My doctor later on told me that, 8 years later, when I met him, Dr. Jothydev, Kesavadev, he was quite surprised, and he said it's quite a miracle that none of my internal organs were actually harmed. But it was only 8 to 10, almost 10 years later after my diagnosis that I got proper treatment, a proper doctor who knew how, what, when, why, and could help me also. But then came all the overwhelming information, For me, that was when I was actually diagnosed. Because then I got all this information about diabetes, all the information about technology, a lot of information that I had no clue about. And I didn't know what to do with it. It overwhelmed me. It went way above my head. And then again, the survival instinct kicked in. Because for me, it was about what I wanted to take from it, to make my life better, to make me feel better, to be at peace. Because I found that too much information, too much technology did not help me. It was kind of making me too much stressed. And I started, feeling a bit wary of going to see him, because he fitted me with the best pump at that time, the 640G. And he used to keep telling me, my doctor is a technophilic. We all know that he's the best at technology, and I am a technophobic person. So bad combo there. And I used to say, and he used to say, you're not using it. to the best of how much, I can understand his frustration with all that information and knowledge of he would have done. I wasn't doing even 1 inch of it. But that was because of the overwhelming, too much newness that I was getting. You should understand that this was at 18 years, when everything was new for me. I was getting new responsibility. I had just become Miss Kerala. So I was, out there in the public field. Everything was just too much. But what kept me instead to understand is that one thing, that light, resilience which I had when I was young, when there was nobody, that resilience kicked in me to filter out what I needed. I did not need to know everything like my doctor. I needed to know what was happening in my body, yes. But that's about it. And then I need to know how I can cater that according to my life, my needs, my activities, so that my life becomes less stressful. And if that means shifting from a pump to an injection, then that means that's what I'll do. But keeping my HbA1c level steady, that is in my hand then, because that becomes an added responsibility then. So that's exactly what I did. That inner light and resilience, because a huge part of type 1 diabetes, as most of my friends can say, is something that individually is different from one person to another. Each of us have our own lives, our own differences, and type 1 diabetes more than me, and how it affects each and every part of our life. Everything, from our dreams, right time to the time we get up, and we are judged. We judge ourselves all the time. Hey, why am I not able to get this A1C right? What's happening? Why am I not being so, good at it like the others? What's missing? Why am I this way? There is a lot of judgment going on there. So I do not want to come to my doctor, where a huge panel of doctors, I'm very sorry, I'm very informal, but you people are like gods to us, and we trust you like crazy. I remember a time when I saw my doctor and a panic attack just stopped. I don't know if you remember. I came to his clinic with a full-fledged panic attack. And I was like, what's going on? I can't breathe. And then my doctor came into the room and I was like, I can breathe now. That's how much my trust level is with him. And when I go to the clinic, I'm watching you. I'm watching my doctor. How does he look at it? How does he see? What is his expression? And it has a huge influence on me. Because somewhere inside, we seek that kind of approval. We seek that kind of understanding from somebody who is already stretched really thin. I know you are all very stretched thin. There's not enough doctors as much as type 1 diabetics out there. But we all need you to be our best friend too. We are asking for too much probably. That's because we go through a lot and we expect you, the least of all, you all to be patient with us. Just patience. So now, go on, you guys.
And just to add to that, I feel that mental health check-in is so much important, that just asking how you were doing and then just encouraging that, yes, you're doing better and you can improve from here. And just the change of words and the language can mean so much for that person, can empower them, motivate them to do so much better. And I would now want to say as a
Jyotsana, there is another side also. So where you are going, that's also very important. In India, total number of type 1 and newly diagnosed will be 24,000. We have millions of villages from everywhere, from anywhere a type 1 can become. He or she will go first to a primary care physician, maybe a primary health care center. You people from Delhi or Trivandrum thinking that what they should expect. But you think of a child who is going to a primary care physician, and he is not having any idea about the type 1 diabetes. He is an MBBS doctor who has seen, and he has just heard about type 1 diabetes. There are millions of diseases in the system, and there are many rare diseases. That does not mean that he could not diagnose and he is wrong. There is a possibility. He is not a specialist. Many times there are people continue to go to them. They still continue to accept that yes, once in a day injection is fine, twice in a day is fine. They are not also going to a proper center. They are not going to a place where actually a type 1 care is given properly. It does not mean that someone is pediatric endocrinologist has to give the best service. Someone is endocrinologist, that does not mean. You have to go and find the right place. So sometimes going to a vegetable shop and asking for a gold, that is also the mistake of a who is the consumer. I mean, that is the most of the time. And the unmet need also you have to understand. I mean, as a type 1, if I have a child or if I myself is a type 1, and if I am going and asking the doctor, I will have to ask my doctor that why my sugar is not getting control, why my child is having continuously depression, why my child is not able to do. And you have to ask the doctor frankly that if you are not the right person, please tell me where I should go. That's also very important from a consumer point of view. If I am going to a vegetable shop, I should expect from him to give me the vegetables. But if I am asking that, why can't you sell me the apple and your orange and all those things, then he will say that you go to a shop which is selling the fruit. And that is also very important. And most of the time, they still continue to take the same medicine, same injection for years together until they develop the complication. They don't change the doctor. That is also. So from a consumer side, it's a big mistake. I mean, if someone have a coronary artery disease, then they should go to the cardiologist. They should ask that what is my problem is, why I am getting again and again pain, will I die because of this? And then they will suggest, no, you go to a cardiologist, you go to intervention cardiologist, they will do invasive procedure and they will find it. So that is most important thing. I think we should go and ask the doctor also that, why I am not getting, these are the things, these are my issues. Please suggest me the right person. He may not be the psychologist, he may not be psychiatrist, he may not have sufficient staff to teach you, he may be a primary care physician, there may be multiple reasons. So we have doctors who are treating from outside the country also. In Oman, he is a physician, Dr. Raveendran, Dr. Tadej from Slovenia, from a developed country where the type 1 comes, how they deal with him. Dr. Jyoti is one of the most technology advanced doctors from India, how he deal with even any other doctor who you may not be seeing regularly, his interest may not be treating type 1 diabetes. The problem is, many of the time the doctor who himself writing himself as a diabetologist, he can't deny that I am not treating type 1 diabetes. He may say frankly that, my bread and butter is to treat 100 type 2 persons who are coming to my clinic. Why I should treat type 1 if I don't have the interest or I don't have sufficient staff? You go to so and so place and there you will get the best treatment. I mean, that is what one doctor should do. And I am telling all physicians across the country, if you don't have interest and you don't have sufficient time, you don't have sufficient staff to deal it, the best way. Are you treating HIV? Are you treating oncology, any malignancy? You will send immediately to some oncologist. You will send someone who is HIV specialist. If you are not treating, like I am not treating many infections, I will send the person to the infection disease specialist. So be frank with the patient, be frank with the family that this is not my cup of tea, I don't deal it. I know that this is the disease known as type 1 diabetes. Someone may be thalassemia major, someone may be hemophilic, someone may be, you may have hundreds and millions of diseases, you may not be a specialist of that. Please refer the place where sufficient staff and system is available so they can deal them in a much better way. They can get the free treatment, free supply from the government side. There are now dedicated clinic which we are opening, government is supporting, health department is supporting, foundations are supporting. But if you are not the best one and if you feel that I can't treat it, please be frank. You are not doing anything wrong. It is better to tell that this is not my cup of tea.
A lot of type 1s live.
In Maldives, this may be challenge. For India,
It's a challenge. In Maldives, it's a big challenge because there are many type 1s living in the islands and there will be only one medical officer available in the island. So it's a question of accessibility. Yeah, I think our young leader, Naf, is here. If she can add to this.
Hi, so I am Naf from Maldives, and I'm the current young leader at IDF. My diagnosis was at the age of 17, so it was a bit later. And about the accessibility, talking about accessibility, I think since the Maldives is a country where the islands are geographically scattered and it's mostly surrounded by sea. People who are living in the capital city, maybe Male or in Hurumale, we may be able to get the insulin and, everything a bit easier. But for those living in islands that are far from the capital, I think it's pretty difficult for them, as they will have to travel, most of the time they will have to travel to Male to get what they need. Or maybe they might have to ask someone that they know from the capital city, okay, go and get me these. So, yeah.
So there is a lot of disparity, where you are born, where you are getting the treatment, who is the treating doctor, your education, your family education, you know about the disease, your family intention to treat, because sometimes we see that 4 child are there and one of them have developed type 1 and the parents are not interested to go anywhere, they don't want to take the further treatment. So there are many reasons for not getting the best care or not getting the best treatment. But I will ask Raveendran, in Oman, what is the situation? If someone type 1, will they go to a primary care physician? Will they go to a specialist? How the primary care physician refers them, and how you get, as an adult physician, do you get the patients to treat type 1?
Usually people with type 1 diabetes, they are not going to the primary care physician. They are going to the special diabetes center, especially meant for type 1 patients in the government setup.
So they are diagnosed and immediately they are referred to those
specialist
center. So that is what the situation in type 1. So in Gujarat now we are starting with the 10 medical college, a dedicated type 1 clinic. So even there are centers, tertiary care center who having advanced technology, advanced training for endocrinology, but even they don't have a dedicated type 1 clinic. So I started talking to the government, central government, and ultimately, because it's a state government project, so decided that the state government in the medical college in the tertiary care, there will be a dedicated type 1 clinic, and which will be run by physician, pediatrician combinedly, along with psychiatrist and some psychotherapist and educator who will be the part of it. Pharmacist also we have to train and teach, and that's what Diabetes India and IDF Southeast Asia have taken that initiative. Probably maybe in a month or 2 you will find that it is happening in our country. Jyoti, what you do, how they are referred to you, or you, because of your foundation, they are coming to you, and how you deal with these type 1 and how you educate your other primary care physicians or physicians who are dealing with type 1.
So, thank you, Dr. Banshi. Before answering to the question, so I should be thanking Dr. Tadej for his physical presence. He is the global leader in technologies and also in the treatment of type 1 diabetes. And we have a title for this panel, and that is a dreams panel. So there are 2 dreams, and one is having Tadej physically present here. That is our first dream, and that is fulfilled. And the second is the title of our own project. And there is a dreams project which is going on in the entire state of Kerala. And Gopika Krishna is the director of the dreams panel, where we have multiple projects running. And I share the same thoughts and experiences from all of you, Mehak, Jyotsana and Indu. There is a gap. There is still an existing gap, and whether the doctors are referring their patients to the specialty centers capable of treating type 1 diabetes or not, that is a big question. A while ago, today morning, I received a call from a lady, and this is from another district in Kerala, and she called me for a discussion on her brother. And her brother is now 32 years old, at home, diagnosed of type 1 diabetes at the age of 5 years, and she called for one reason. The brother is staying with mother, and they two are the ones staying in a separate home, and the brother is having a serious psychiatric problem, violent all the time. And on questioning, I found that this guy is blind bilaterally, both eyes, with diabetes, and he's also having nephropathy and getting treated in the same place for more than 10-15 years. And I remembered you always telling that in pediatrics they get treated, and then the complications set in when they are adults. And those who are originally treating never get to know that they are getting all these complications. And this is the reality even today. So this happened today morning. So are we actually reaching our goals? Are we in the right path or not? So I also happened to see a person who was on an insulin pump for the last more than 12 years on a single basal profile, treated by a neighborhood doctor, and the doctor didn't have any experience using an insulin pump therapy, and the patient was blaming me, and he said that you have been treated. I said, I have never seen you before, and he said that I saw you in the media, in the YouTube and in television, and then you advised insulin pump therapy for type 1 diabetes, and I went to the nearby doctor. So this is very important, critical that we need to be a specialist, and the patients need to be referred to the specialty centers. And all of us, including me, Dr. Banshi, Shiru, Raveendran, all of us, including the patient community, we are deeply indebted to ATTD, right? ATTD founded by Dr. Tadej Battelino, sitting towards the left of me, for all the inspiration, because they only innovated and then introduced all these newer therapies, and then it was something enlightening that in type 1 diabetes, insulin alone is insufficient. Glucose monitors alone is insufficient. And you can complete the circle, you can close the loop only with the help of technologies. And the technologies keep on evolving, keep on advancing. And without integrating technologies, it is impossible. It is never possible to have a successful outcome in type 1 diabetes. And the government of Kerala, we have been probably the first in the entire country to have a type 1 project. But if you ask me whether it has been successful or not, I don't know. And in the evening, we are all having a panel to discuss the sweet project, it's a Mithai project in Kerala, and that is a separate discussion with the government doctors in study, and Banshi is physically present for this program, on how we can further improve the currently running project. Because we believe that education is most important. And that education is not for half an hour, for 1 hour. It should be an education which is a constant, continuous process. And in the Dreams project, we are also launching another vertical tomorrow, and that is Dreams Guru, where we are going to have a course for teachers in Kerala. And that is not for half an hour, for 1 hour. It is going to be a course for type 1 diabetes.
I think that we should also educate, type 1 community overall, that where they should go and what they should expect. That's very important.
Where to get treated.
And Mehak, as you are doing a lot of online activities and a lot of this, there, we are forgetting and asking that what they should expect from the doctors, where they should go. Nobody is saying them. We don't want to choose, and as a doctor, if I go and I say that you should come to me only, like you are marketing yourself, but even if someone has to say that, you should go to the right doctor. That's the most important thing. Unless you go to that, you will not get the best treatment. That's not possible. I mean, that is what I request. So what is, in Mehak, there may be many patients who must be asking you, because you are doing a lot of online teaching program, or Jyotsana, you are running a foundation. What are the questions they must be asking? And then, you must be trying by educating them, whatever the injection or insulin is they have. But are you suggesting them to go to a right doctor?
Yes,
That
sir.
is also, I think, very, very important. Without that, you will not get, because someone has to, take
Right.
care of you round the clock.
Yes, sir. Thank you so much, sir. Sir, the importance that you mentioned regarding the right doctor and the right care is very important. But something which I want to emphasize more is that when they are going to the right endocrinologist or diabetologist also, in that case also we have to be very selective when an endocrinologist refers them to pre-mixed dosages.
It's not the degree which is important. It
Yeah.
is that how,
Knowledge,
yeah.
how
No, not
you-
the knowledge. How you are communicating with them. You
Right.
have that, you just want to treat. There are many endocrinologists, diabetologists who may be the expert in field of type 1 diabetes, but they don't have the time and they don't want to treat it also.
Yes, yes,
And
sir.
that's what I have already requested every doctor in India, that if you don't have the time and you don't want to treat, you can say simply that I don't have the time for
Right,
treating.
right. So, sir, one thing I want to mention, sir, sorry, please.
Yeah. See, the panel is what I wish doctors knew. So let these four gentle ladies tell us what they expect and what they want doctors to know. We all know what we are doing in our practice.
I can ask to Indu. So there is a type 1 patient, you will be treated, Phil Sutherland. I think that Banshi must be knowing. He has the I think he has done a cycle racing and more than 3,000 kilometers run. And he has invented or he has given some advice to the medical community that we are following for the type 1 diabetes in exercise. So really, will be happy to know what you do for the exercise, what you do for your diet, whether you ask your doctor, should I take ice cream or what I should take or not. So can you tell about that?
I think you were asking about my diet. Exercise and diet. Yes, of course. My doctor, the time he met me, I think my doctor must know me as a kind of person, a patient who you don't do things and she won't do it. You have to tell her why it's important and how it's thing. And it's not easy working with me. Of course, he told me why certain foods and certain things and how the stuff actually work. But I think he trusted me with the rest of it because, like he said, there are parts that he doesn't know that I know. He has information, valuable information that I do trust him with my own life. So I know the information I get from him, I take, and then I cater it to my needs. Especially when I work in a field like acting, it's very difficult. They don't have a proper fixed schedule. There are days when you cannot exercise at all. But where and how I find time and how I find my exercises in spite of where I am, that is up to me. That part is actually up to me because that is why each and every person has to cater and take in the best information from the best doctors who are ready to help you, ready to give you that information, and then use it to the best of their ability in a way that they can in their life. So yes, he definitely helped me because I've always asked him and he's always told me, you cannot just go do hardcore cardio, which I used to do. Don't do that for 3 hours, 4 hours. Don't do such things. And I used to ask him why. And then he'd tell me, of course. Throughout my time with him, he's always been helpful because even a small minor fluctuation somewhere I feel, I go to him or I message him. Even if I'm traveling or working, I ask him, see, something's off. What's off? What's going on? And then he tells me. And even though I may not be very comfortable with that decision, it's my responsibility to take in that information because he knows, after all, he knows so much more than I don't. And then I know my part, that is so much more about this that he doesn't know. He cannot help it if I don't follow his advice or if I don't cater that information to my needs. So yes, it's it's a teamwork. That's exactly what I feel.
Yeah, so I'm going to just come back to your question and answer the topic in discussion that we're having. Thank you so much for sharing all your perspectives. And I think one piece that we are missing in the puzzle and which we are talking about is the community. The community is something that can really change the game and paradigm of how patients are being empowered to how to communicate with the doctors, what to expect from them, what to expect from themselves, and how to live the life, not just merely survive, but thrive with this condition. And we are living examples of that here, that, we have learned the art of living well with the support of our doctors because we know how to communicate with them, and that is why community is bridging that gap. So I always say that medical expertise and lived experience, when combined together, it really creates magic. And it helps so many to be empowered, inspired, and motivated to learn the art of living well with this condition. Because we don't want people to just merely live every day and manage the symptoms. We really want them to thrive and do what they want to do and dream of becoming anything, And I think representation matters a lot, and which community provides. Like yesterday, Barbie was launched, and you see what kind of amazing impact it has made. So many people have already ordered, and so many people felt like, okay, now they have something that they can relate to. And that's what community gives. When a child comes and sees someone else wearing a CGM or a pump, you don't know how much confidence they get to show their devices and to wear them confidently. And that's what we are doing through community. And, we all have been working since almost a decade in this. And I can truly say that, when doctors partners with community members and patient advocates like us, that really, really changes the game. And that really helps people to learn and become better in their lives.
Thank you, Jyotsana. So now I will ask Tadej that, what is the situation in your country? How a type 1 and how they are expecting their family members with the doctors, and what is the system of treatment? We know that we have a lot of disparity in our country. We have people who have to pay from their pocket, a lot of reasons for them not to have a good control, or a lot of reasons for them to have a better control also.
Yeah, first, thank you very much for the invitation, and the title is What We Learn, right, from you. So obviously, I am embarrassed. I'm coming from an environment where everything is free to people, so they pay nothing. They pay nothing to see me. They pay nothing to get any AID, any closed loop system they choose, and all the things that come with it. They pay nothing for psychologist, for psychiatrist, for dietitian. So everything basically is free. Do they really cherish this? No. They believe it's normal. So do we have the same problems? Exactly the same. So it is not the money problem. There is no money problem, but there are still disparities. And disparities come from social background, mostly. So if the family is well educated, of course, it is a very different story. And this is exactly the same as here. So if your prime minister, who seems to be a very nice man, decides to pay for closed loops to people with type 1 diabetes in India, which I think should be a very good motion, then you will be like Slovenia, but then the problems will remain. I work with type 1. I'm also a clinical pharmacologist by specialty. So I work with all ages. I mean all ages, from 0 to 100. I rarely see a person above 100 in my practice, because there are not many. What I learned from them in the last 37 years when I work is that one thing, of course, as you, both of you, or all three of you mentioned, that I should listen more, right? But then, is this very specific? Well, I also have to listen to my children. They're all older than you, I guess. And unless I listen to them, I have no influence, right, whatsoever. So this is a normal human relation. So what I call this is that you first establish a human relation with the person with diabetes. As soon as the person with diabetes understands that he's just another human in your eyes, it works. And then the second thing is, and this is very important for my center, that we must discuss glucose. And I really want to put this discussion on the side of the person with diabetes. I mean, glucose is super dangerous. Those that will come to my lectures, I will try to show. It induces dementia, which to me is more important than cardiovascular, and all these bad things. And what is important is that we now understand this is completely preventable, 100% preventable. So there is no need nowadays that a person with diabetes has any complications at the age of 60. You know, some people become 60. It happens to people. And this is very important. So we do not require from people with diabetes something that is not achievable. Nowadays, with technology, if they can get it, it is perfectly achievable. And this is the thing that we need support of people with diabetes. Why? Because young people don't listen. Do you think that in my country a young girl listens to me? There is no way, right? But this same young girl will listen to a person with diabetes. So yes, we need them and we use them. We have summer camps. We have many occasions where more mature people with diabetes of your age talk to younger people and try to relate this direct thing. Look, glucose is important. Do something about it, right? They say it in a better way than I can without type 1 diabetes. So it's not only that, you know, their voice is important to us. Their voice is super important to younger people with diabetes. So we also always, every year, have these transgenerational meetings. So funnily enough, my department gives 50-year medal, like in Jocelyn. So we give 50-year medals, always in front of the youngest people. Because they should see that after 50 years, they still walk around, smile, do everything, if they were able to manage glucose. So in the end, glucose is not something that is insulting to people. It's a problem. And believe me something, in this very room, if all of you put sensors on your arm, Libre, more than 80% will have hyperglycemia. If anybody doesn't believe it, try it. When I was young, I put a sensor on me, it was a straight line. I become older, I put a sensor on me, it is not a straight line. And this glucose is as dangerous for me as it is for these young people. So we all, as a community, should take glucose seriously. Glucose is a serious thing. It's not a little bit elevated. I will show you data, only also within the normal range. People with lower normal glucose are 3 times less to get cardiovascular event than people with normal high glucose. So it's for all of us. So in the end, this is an important message to you. Glucose matters to every person, basically. Yes, you're more busy with it, right? But in the end, everybody should be. And this is the thing that you should relate back to people. Glucose is my problem, yes, but it's your problem also. You may just not know it, particularly in India, where people are prone to type 2 at a very, very early stage of obesity. So perhaps you, as an example, can do a community in India, large community, 2/3 of the population at least, which is 1 billion people, I understand, that should fight glucose together. Because glucose is a bad idea. I can tell you, if you don't believe me, I will share data with you and you will tell me. Glucose is not a good idea. Thank you.
Thank you so much, sir. Thank you, everybody, for mentioning the importance of community. I just want to add one point here. As we know, community is very important, but there's something that I realized when I was dealing with community. A 21-year-old girl, MD student. She was an MD. She was doing sports physiology, and she came to me crying. And I asked what happened. And she said, my doctor told me I'll be okay after 1 year. She's already a medical student, medical practitioner, and she said, I'll be okay in 1 year. It's already 1 year, why I'm not okay now? Why am I still taking insulin? So one thing I want to emphasize, honesty is also very important. When a person is diagnosed, we know it is never going to be okay. We know there is no cure. Don't give them the hope that they'll be okay in 1 year. And this girl was a medical student. When I saw her crying, I realized, what about the other one? Others, when we tell them, I know the intention is right. You feel that in 1 year they'll get used to the diagnosis, but they never do. Even after 18 years of living with type 1 diabetes, I still have hope that one day people say it will be okay. So when a doctor says that it will be okay next year, no matter how much knowledge I have, I'll still hope that I am okay. No matter how I say that it doesn't hurt, it still hurts. No matter I say that now I'm used to taking shots, every time I take shot, I still flinch, and every time I change my CGM, it still hurts. It's just that we don't say it often now. You can say we get used to it, but I believe we never get used to it. So with this, I'd like to thank all of you for listening to what we have to say, and thank you to the wonderful panel for adding on to their points. It was all very important, and we would like you all to think about our mental health, our stigmas, which we don't speak very often, but we still go through them. Thank you so much.
Anyone else wants to make any comment? Otherwise, we close this session. Yes, Dr. Amit.
So this panel discussion was really excellent, and I would just like to highlight that Jyotsana as well as Mehak, they live close to me in Delhi only, and many patients with type 1 diabetes come to me, and they have rightly said that we don't have that much time, or even as Dr. Tadej have highlighted that even if we tell them that do this, they won't do. So I make it a point that I connect either to Jyotsana or to Mehak, and I see a remarkable change in their lifestyle as well as the behavior. So I think this participation between the people living with type 1 diabetes and the healthcare professionals is very, very important.
Very true. So with this, we close, and thank you, Jyoti, for wonderful panel discussion which you have started with the program, and thank you once again to all the speakers and all panelists. Thank you very much.
Thank you to our incredible moderators and panelists for sharing your voices, vulnerabilities, and strength with us. You remind us why we do what we do.